in my pregnancy with my daughter Samantha when a echogenic ball showed up on her ultrasound. Doctors sent me for blood work to test for toxoplasmosis, CMV, and herpes. Everything came back negative except for CMV. I was then sent for more blood work to determine when I had been exposed. They told me that my exposure had happened years before I was pregnant and there was no way my baby had contracted congenital CMV. They continued to follow my pregnancy very closely, and I had lots of ultrasounds. At some of those ultrasounds, they would say the baby looked healthy. She was a little small, her head was a little small, but you and your husband aren't big people, so why would you have a big baby? And then at some of those ultrasounds, they would say her head's too small, her body's too small, there's too much fluid in her brain, something's wrong. And that went on from week 18 to week 38 when I delivered Samantha naturally. And the room immediately filled with doctors and nurses. It was very different than when I had had my son. I kept on hearing the word microcephaly, microcephaly, but no one was saying it directly to me. Before my daughter was handed to me, a nurse told me that there was going to be little pink and purple dots on my daughter, and that was petechiae and not to worry. After we got to cuddle with her for a little while, she was seen by the pediatricians at Millard Fillmore Suburban, which is where I delivered. They came back to my room to let me know that Samantha had an enlarged liver and spleen. She was severely jaundiced. She had microcephaly. They believed she had congenital CMV and that she needed to be transferred to the NICU at Women and Children's Hospital. I was in complete denial, especially after what I had been told during my pregnancy that there was no way she had CMV. And I didn't believe these doctors. I thought they were missing something. Anyway, she was transferred. She received intense phototherapy for multiple days and a platelet transfusion for a low platelet count. She was, of course, tested for CMV. The NICU was a blur, but I know that we were at least 4 days into her stay there before we had a positive CMV test. And I know that because on day 3, when I was no longer a patient, they asked me to be retested for toxoplasmosis so they would feel comfortable treating her for CMV. So we had the toxoplasmosis test back before we had CMV, and it was the toxoplasmosis test that made the doctors start treating her for CMV, and that's when they started her on valganciclovir. And that's when we were told that it was, of course, CMV 4 or 5 days in. When Sam left the NICU, we had confirmed diagnoses of the congenital CMV and microcephaly. She had passed her hearing test on her right ear. They deferred on her left. She did not fail. And a later test would pass on her left. She didn't. At 3 months old, they passed on both ears. So we left the NICU being told just to watch for developmental milestones. This is a wait-and-see game. Sam never met any of her milestones. Sam never crawled. Sam never sat independently. Sam never walked. Sam never talked. Sam is now 3.5 years old, and as a result of CMV, she has spastic quad cerebral palsy. She has hearing loss in both ears. She has microcephaly. She has epilepsy, and she is legally blind. She's also dependent on a G-tube for all of her nutritional needs. She's a terrible sleeper. And she has severe acid reflux. We've had hospital stays for respiratory illnesses because she just doesn't handle colds like other kids do. Hospital stays for EEGs, etc. When she was 17 months old, I had to leave my place of employment that I had been for 8 years so I could care for Sam full time because it was too difficult for anyone in our family to handle Sam anymore, and it was too hard for me to work and take care of Sam and keep up with all of her appointments and all of her therapies and arguing with insurance companies for medication or equipment that she needs. So I take care of Sam now full time, and it's the hardest thing I've ever done. It's the scariest thing I've ever done. It's also the most rewarding thing I've ever done. Anyways, I appreciate anyone that's talking about CMV, raising awareness about CMV, testing for CMV, especially after my pregnancy. I had so many doctors tell me it was not CMV. And that made it so hard to grasp that it was CMV, and anything that would have made it faster to know that it was CMV. To be in the NICU for 4 days and people telling you it's CMV, but you've been told by other doctors it wasn't CMV, it's so confusing. And you don't believe anyone. So, thank you for listening to me ramble. And thank you for raising any awareness about CMV, because no one knows anything.